Welcome back to End Time TV. You are watching On the Edge Conversations in Medical Sciences Research. I'm Dr. Jonas Moses. Today we are talking with Dr. Richard Baltaro. Dr. Baltaro is a pathologist. We have been talking just before the break about the different kinds of laboratories that do receive this accreditation. We were just talking about North America. Let's pick up there. You were telling me that of the 100 or so hospitals in the United States that have pathology labs, your organization accredits all of them.
That is correct. This is according to Modern Healthcare in 2004.
All right. So what about those? I assume that there are plenty of pathology labs that are independent of hospitals. What about those?
Yeah, we accredit essentially all the major ones. It's a voluntary accreditation, so they don't have to be accredited by us. States also accredit. CLIA has delegated to states to do this, and there are certain groups that accredit certain areas. For example, cytogenetics is accredited independently. ASHI, which is the American Histocompatibility Society, which I'm an inspector accepted by them, by the way, accredits some of them. The American Association of Blood Bank has, we actually work with them. Frequently, we will have one of their inspectors or more, if they're particularly large, that will come with our team. Now, I didn't say, but we are unannounced. So the laboratories do not know when we're going to show up.
Oh, intriguing. So they don't have a chance to prepare for this.
No, they do have a chance to prepare. We have all our material on the web. We give educational courses. They are supposed to self-inspect. Approximately 1 year before their next license expiration, they have to do their own self-inspection, and if they find that there are things that have changed or improved since then, they're supposed to make changes in their processes and in their system. And by the way, we're in a constant flux because we have new equipment, new maintenance of equipment, new technology that needs to be constantly updated, and what goes along with it is procedures. You need to have a system that is documented. So if any one individual is not there, somebody else may be able to step in and do the job. Because hospitals in particular are open 24 hours a day, 7 days a week.
Indeed.
And you have to be also be prepared for emergencies, disasters, whether it's bioterrorism or more commonly natural catastrophes.
So you mentioned 1 year before another accreditation. For how long are these accreditations good?
We have been having a 2-year cycle.
All right.
So every 2 years we will present ourselves before the due date, or when the license expires. Typically in the last 6 months, when we present ourselves unannounced, as I said. You may get a call at 7 or 8 o'clock in the morning that, or we may just show up.
Yeah. So obviously the idea being that if the laboratories are maintaining the proper practices and following the criterion as posted, and that you supply, a surprise visit shouldn't raise any surprises for them.
No. I mean, we give deficiencies, but we also give recommendations.
Okay.
And recommendations are frequently what the experts think is best practice.
Okay.
And today's recommendation may very well become tomorrow's deficiencies if you don't change your processes. So it's an educational process. We actually like to do it because we ourselves learn a great deal about other laboratories, other processes, other technology. We have different equipment in different places, different manufacturers.
And what happens if you visit a lab and the lab isn't up to par? Does this mean closure, or what happens?
The lab, we give them our list of our deficiencies and recommendation. They have 30 days to respond. If they do not like certain objections or deficiencies, they can appeal. there is an appeal process. There are various commissions of experts in those fields that will actually examine that. And they may decide that the inspector was correct. They may want to review their process. It's a continuous compliance, continuous improvement process.
May I assume or imagine that it's fairly rare that you have to literally close down a lab?
Yes, that does not happen that often. Number one, we tend to inspect most of the labs, but we tend to inspect the best labs in the world. And people know what our standards are. They try to comply. And it is not common that we do close labs, but I myself have closed some labs. Typically, we give them the deficiencies, and if even if they are working on their corrections, we may send an unannounced team at a time different than before the licensing. I mean, those are team labs that are on a probation status, shall we say.
Now, thus far we've talked about laboratories affiliated with hospitals and universities and so on. Do you also inspect labs in industry?
Yes,
okay.
Yes.
And
there usually have to be laboratories that are taking care of patients,
okay.
patient specimens. Sometimes there are laboratories that do research, drug research and other types of research.
Sure.
So, and labs that are working on molecular tests.
And are they accountable for the same kinds of...
Yes, we have an international standard that we want everyone to meet.
All right. And speaking of international, and we'll probably continue this in the next segment, I imagine, but let's start talking a little bit about the international process. You mentioned that you speak several languages. I can imagine that it's critical to be able to, as you travel around the world, communicate with the other pathologists. Not everyone speaks English. Although we in the American community tend to believe so sometimes. And when we come back from break, I do want to talk about your travels around the world. We are going to a commercial break. You're watching End Time TV. I'm Dr. Jonas Moses. Stay with us. Great show. Don't miss it.